Three Ds. I'm proud to stand with Delegate Kerry Delaney, Delegate Darius Clark. Senator Bill Stanley's not here, but he will be a chief co-patron of this legislation. We will introduce legislation to create a prescription drug affordability board. Virginians of all ages and in every corner of the Commonwealth have dealt with the unaffordable cost of prescription drugs for far too long. Virginians like Mara, who you will hear from later, lives with Crohn's and Addison's diseases, affording her medicine, which can cost tens of thousands of dollars as a matter of life and death. Rapidly inflating drug prices are the major cause of the unaffordable health care crisis Virginians are dealing with today. We are coming to you with a bipartisan, bicameral bill that will address the cost of medication and make life more affordable for all Virginians. A prescription drug affordability board is an independent body of health and medical experts that use proven data-based strategies to evaluate and lower prescription drug prices. From young families to senior citizens living on fixed incomes, all Virginians are facing an affordability crisis. If we want to make Virginia the best place to live, work, and raise a family, we have to bring down not only the cost of living, but more importantly, the cost of staying alive. Following November's elections, Governor Youngkin said voters want us to come together and find common ground. I couldn't agree more. That's why I hope he will support this solution, which not only has bipartisan support here in the General Assembly, but bipartisan support across the Commonwealth. A recent poll from the AARP found 3/4 of Virginian voters want their legislators to pass a prescription drug affordability board, including 85% of Democrats, 71% Republicans, and 70% of independents. This is undoubtedly a crisis here in the Commonwealth. Virginians are spending nearly 40% more on prescription drugs than the average American. We spend $1,500 compared to $1,100 nationally. That's $400 more per year than the national average. That's just unacceptable. It's time to establish a prescription drug affordability board to help end this crisis. This independent, nonpartisan board would have the authority to evaluate certain high-cost medications which present a significant burden to Virginians. The board will follow models set forth in other states to consider a broad range of economic factors when setting appropriate payment rates for reviewed drugs. Allowing pharmaceutical manufacturers the opportunity to justify existing drug costs and determining a fair payment rate, the board can set an upper payment limit that applies to the entire supply chain. It's a proven approach that's been implemented in other states. Now it's time for Virginia to take action to lower the cost of medicine. This legislation is part of a broader 3-bill prescription drug affordability package, including the bill for transparency on pharmacy benefit managers' fees from Senator Stanley, Delegate Altuza-Reeser, and a bill for improved efficiency for state government prescription drug spending from Senator Scavlin Van Valkenburg and Delegate Destiny LaVere-Bolden. I hope Governor Youngkin and my colleagues in both chambers and across the aisle will join me in supporting this crucial proposal to bring down the cost of prescription drugs for all Virginians. And now, to speak more on this important topic is Delegate Kerry Delaney.
Good morning, everyone. I'm Delegate Delaney. I represent the new 9th District of Virginia House of Delegates, and I want to thank you all for joining us here today. I'm really proud to stand with my fellow legislators and these incredible advocates in the room to call for the establishment of a prescription drug affordability board. The board would help thousands of Virginians across this Commonwealth afford life-saving medications, including members of my family. My daughter Caitlin has type 1 diabetes and will be dealing with daily medications for the rest of her life. And it's not just Virginians living with chronic illnesses like my daughter, but a majority of Virginians have personally felt negative effects of the rising cost of medicine. In fact, Virginians are being hit harder than people in other states. In 2020, our residents spent 36% more per person on prescription drugs than the national average. And 35% of Virginians report not filling their medications as prescribed. While Virginians are struggling to make ends meet, big pharma companies are raking in historic profits. The largest pharmaceutical company nearly tripled its earnings over the past 2 years, bringing in $100 billion worth of revenue, while life-saving drugs went up in price for Virginians. Although they were bringing in record profits in 2023, pharmaceutical companies still hiked the list price for 112 drugs at a rate higher than the rate of inflation, pushing the cost of life-saving medications further out of reach for the average Virginian. Now prescription drug costs are taking up a greater share of the average family's healthcare budget, rising to nearly 25% of overall health insurance costs since 2018. I want to live in a commonwealth where my daughter never has to weigh the cost of buying groceries against the cost for paying for her medication. It is time to prioritize Virginians' health over pharma profits. Today, I'm asking my colleagues to support a prescription drug affordability board so that we can take meaningful action to lower the cost of medicine and make Virginia a more affordable place to live. In November, Governor Youngkin called for bipartisan legislation on cost of living. There is no better place to start than on this critical bipartisan bill to address the astronomical cost of prescription drugs for Virginians. This legislation is a check against price gouging pharmaceutical companies who would otherwise charge whatever they want. PDABs have been established in both Republican and Democratic administrations across 8 states, including Minnesota and Colorado. So I hope my colleagues across the chambers and across the aisle will join me in supporting this critical legislation. And now I would like to introduce my colleague, Delegate Darius Clark.
Good morning. It's my pleasure today to join you with my colleagues. My name is Delegate Darius Clark, and I'm here to talk about why I'm co-patroning this bipartisan legislation to lower the cost for Virginians to rein in the greed of big pharmaceutical companies. This bill makes simple, common sense reforms that empower independent healthcare experts to set reasonable caps on certain high-cost drugs. For too long, this opaque, hard to navigate system has kept families confused over why their drug costs are 3, 4, 5, and sometimes even in the 6-figure range. More transparency and fair analysis from experts is a win for all of us. It means Virginia families will finally have a group of people committed to using data, not profit, motives when setting the price of certain high-cost drugs. Let's be very clear here. Lowering prescription drugs costs is a racial and economic justice issue. Illnesses like diabetes disproportionately impacts Black and Latino households. And the treatment for diabetes continue to skyrocket. The drug companies might claim they offer patient assistant coupons to those who struggle with the cost of drugs, but they also deny 97% of the uninsured, who are disproportionately people of color. A national poll by Kaiser Family Foundation found that Black and Latino families were more than 10% more likely to report being unable to report difficulty affording the medicine they need. That means more Black and brown families are being put into a position where they will have to choose between treating illnesses like diabetes or putting food on their table. This shouldn't be an either-or situation. Families deserve to be able to pay for their bills and get the medicine that they need to live a healthy, prosperous life. We are already seeing the Inflation Reduction Act begin to lower prescription drug costs for seniors on Medicaid with a new provision this month kicking in the month to cap the out-of-pocket costs at $3,300 per year for brand name drugs. This is great news for the 1 million Virginians on Medicaid, but we also have 7 million people who are not. As the youngest member of the General Assembly, I want to make sure that we are taking action so that way the younger generation can also afford the medicine that they need, including people with chronic conditions and rare diseases. I don't care if you're a Democrat or if you're a Republican. I look forward to working with every lawmaker this session in this building to get this bill to the governor's desk and sign into law. And now I have the pleasure to bring forth Mr. Jim Dow with the AARP. Thank you.
Good morning. My name is Jim Dow. I'm the State Director for AARP Virginia. On behalf of our nearly 1 million members here in the Commonwealth, I want to thank Senator Deeds, Delegate Delaney, Delegate Clark, Senator Van Valkenburg, Delegate Reeser, and all of our legislative champions, including the other bipartisan members of our legislative group of champions that are going to make a huge difference in trying to rein in the price of prescription drugs. It is long past time that Virginia makes meaningful action to rein in the cost of prescription drugs. This is consistently the number one thing that we hear about from our members and other Virginians over the age of 50 across the country, and from Americans all across the country, across the state and all across the country. For people over the age of 50, and for seniors especially, the price of prescription drugs isn't just about the cost of living, it's about the cost of staying alive. AERP, along with other members of our consumer coalition, are going to be supporting a package of legislation that's going to try to help them afford those prescription drugs. The centerpiece, of course, is the enactment of this Prescription Drug Affordability Board, which has been really well explained by our legislative champions before me. I will echo something that Senator Deed said, which is that aside from being good policy, it's also great politics. The Watson Center for Civic Leadership at Christopher Newport University did a survey of registered voters of all ages a few months ago for AARP. And voters by 75 to 25 said they overwhelmingly support this. They support this legislation. That includes 85% of Democrats, 71% of Republicans, and 70% of independents. The Prescription Drug Affordability Board will help make key medicines more affordable for Virginians and save taxpayers money. It's no surprise that this is a bill that passed with strong bipartisan support in the state Senate in 2023. And it's not a surprise that the Virginia Commonwealth Council on Aging, which is composed of both Republican and Democratic appointees, specialists in the area of aging, recommended creation of a Prescription Drug Affordability Board. And it's been endorsed by groups such as the Virginia Association of Counties. Still, there is no single silver bullet that's going to stop the crisis of runaway prescription drug prices. That's why we are also supporting bipartisan legislation being carried by Senator Bill Stanley and Delegate Atusa Reeser, thank you for being here, to improve transparency around pharmacy benefit managers. Clarity and accountability are important throughout the entire prescription drug supply chain. Finally, we're supporting legislation from Senator Skylar Van Valkenburg and Delegate Destiny LeBeer-Bolden to consolidate state agency prescription drug purchasing and explore bulk purchasing options. Improving Virginia's drug purchasing and saving taxpayers money is a common sense solution that should be able to garner support from everybody across the spectrum. Governor Youngkin has understandably put his focus on improving the lives of Virginians by addressing challenges to the cost of living. There is no issue as important for millions of Virginians of all ages in terms of the cost of living and the cost of staying alive than the skyrocketing cost of prescription drugs. And as our survey from just a few months ago shows, Virginians of all ages are expecting results. They're expecting action from their representatives here in Richmond. So with our legislative champions, I look forward to this session doing just that. So thank you, and it is now my pleasure to introduce probably the most important voice you're going to hear today, Mara Shapiro.
Thank you for giving me the opportunity to share my story here with you today. My name is Mara Shapiro, and I'm a resident of Charlottesville, Virginia. Like many others, I have been directly impacted by the crisis of skyrocketing prescription drug costs. I'm 23 years old, I work full-time in the medical communications field, and I plan to start my master's in public health this year. But I'm also a patient advocate, and I'm very passionate about health policy issues such as drug pricing and how they affect young adults in particular. I live with Crohn's disease, a form of inflammatory bowel disease, as well as Addison's disease, which is a rare form of adrenal insufficiency. And both of these conditions require me to take prescription medication. I take a drug called Stelara, which helps keep my Crohn's disease in remission. And I take Solucortef, a medication that replaces the cortisol my body no longer produces on its own. If I lose access to Solucortef, for example, I would lose my life, because this is truly a life-saving medication for me. On the other hand, the price tag of my Stelara is upwards of $20,000 a month, and I worry every single month about the possibility of having to pay this cost out of pocket. It is so expensive that Medicare chose it as one of the first 10 drugs for price negotiations that is starting now thanks to the Inflation Reduction Act. Now that's great news for people on Medicare, but we desperately need action for those of us not yet on Medicare. We need to lower the cost for everyone who needs it, which is what a prescription drug affordability board could do. While the price of my Solu-Cortef medication isn't as astronomically high as the Stelara is, I would say there's still a significant cost burden associated because it's a drug with no alternative. I don't have any other option than this one particular drug. So for example, if the price of Solu-Cortef were to triple tomorrow, I'd have no other option but to pay that because it simply keeps me alive. Prescription drug costs are not just numbers on a bill. They represent a choice between getting the medication you need to stay healthy and sacrificing other necessities like groceries, paying bills, or paying rent. 1 in 4 Virginians who depend on prescriptions like me don't take their medications solely because they can't afford them. It's truly a heartbreaking reality that so many face every day. That's why I'm here to lend my voice to support of a prescription drug affordability board in the state of Virginia, especially for fellow young adult patients with chronic medical conditions who are trying to become financially independent. A prescription drug affordability board represents hope. Hope for financial freedom and equality, just like our healthy peers. Imagine a Virginia where the cost of medicine doesn't force individuals to make heartbreaking choices. The Prescription Drug Affordability Board could be the solution we desperately need. It would evaluate prescription drugs and set reasonable rates for Virginians to pay, ensuring fair and affordable access to life-saving medications. Virginians deserve affordable access to the medicine they need to lead healthy and happy lives. I'm here to urge you to support the Prescription Drug Affordability Board and to stand with Virginians like me who dream of a future where health isn't a luxury. It's so heartening to see this initiative enjoy wide support across party lines. Now let's work together to make prescription drugs more affordable for all. Thank you so much for listening and for your support.